to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks.
Today, I have the pleasure of introducing Dr. Famuyiwa. She's an MD, fertility specialist, and founder of Montgomery Fertility Center. She is a distinguished fertility specialist and founder with over 2 decades of experience in reproductive health. Dr. Yemi is dedicated to helping individuals and couples achieve their dreams of parenthood through personalized and compassionate care. As a graduate of Emory University School of Medicine, she completed her residency in obstetrics and gynecology at Georgetown University Hospital, and after her fellowship in endocrinology and infertility at the National Institute of Health. She is a board-certified OBGYN and a fellow of the American College of Obstetricians and Gynecologists. With no further ado, I'd like to introduce our guest. Thank you for being here, Doctor.
Thank you so much for that kind introduction. It's my pleasure to be here.
Yes, one thing I will say about you, for our listeners who don't know, I appreciate your presence on social media. You are a constant reminder about fertility awareness. You keep it real, and I appreciate it. You do stand out, and that's one of the reasons I wanted you on this show.
Thank you.
Because I really wanted to highlight this issue that plagues many couples, individuals trying to start a family.
Yes.
And that is the question of infertility, fertility, however you want to call it.
Yes.
And the challenges associated with that.
Yes. So, one of the things I try to do on social media is to be that lone voice in the wilderness, beating the drum.
Definitely. So, let's look about how this problem came about, right?
Yes.
More and more women are joining medical school, getting into medical school, right?
Yes, correct.
And the career it's a long journey. It's a decade plus, right?
It is, yes.
From the moment you go to university, you're busy trying to get those grades, trying to get your MCAT scores, trying to get into school, trying to finish school, get into residency. It's grueling. Yes. And many times we put our life on the back burner.
Exactly. I think that you have nailed it on the head. Female doctors are extremely busy and they're dedicated. They're a unique unicorn of a unicorn.
Yeah.
They love their patients. And, they're also that female nurturing, caring persona. And we bring that to the medical field. And some people care so deeply about what they do that they don't think about themselves. They put themselves way at the end.
Most definitely. As someone who's experienced burnout and exhaustion, I relate to that because many of us give and give and give, partially for our own expectation and societal expectations.
Exactly.
And by the time we realize, oh my goodness, we're getting older and we're like, we should settle down. You should find the right person, but you've been so busy, you haven't made the time to do other things, meet people. And suddenly you're like, okay, I'm in my 30s or maybe later. And you're like, I want a child.
I think you just nailed it on the head. We don't think about ourselves. And certainly in medical school, I know when I was training, I was laser focused. I wanted to go into medicine. So I was laser focused in my undergraduate years, laser focused in medical school, laser focused in residency, because you had to get a good fellowship, correct?
Yes.
And I was also sort of laser focused in fellowship, started to unfocus a little bit when I went into the fertility field and I saw more and more patients with infertility. And I'm thinking, oh my gosh, this could be me. this could be me. This could be me. So I started to say, oh my gosh, I don't want to be in this situation. I really do want a family. I need to start thinking about it. And then that's sort of the story of my life.
Yeah, I hear you. I can relate it even in my own life. I started my practice before having kids. And if anyone who's listening, I would say have your children before you go deep into running and owning a practice, because you set the bar for your patients. If they're used to you being there available regularly, and then suddenly it changes because you're pregnant, you're sick, you have young kids, it's a tough battle. But you have to put yourself first because you only have this window of time to take care of you and
Yes.
this really important part of our lives. So
It's really hard. It's, I
yeah,
mean, I was there, I went through these experiences. And if I look at some of the things that formed my life and what I went through, I really did enjoy my training. I'm one of those nerdy people that love science for the nature of science. I was constantly reading. I love what I do. I love science. I love studying. I love reading articles. But I remember when I was in medical school, I did a rotation in plastic surgery and ran into this fellow. He came from South Africa. And every time we had a meeting or we went somewhere as a group on our plastics rotation, he was always with his son. And he was like, my son, my son, my son. I'm like, what is this, my son business? Come on, what's going on? And he says, oh, Yemi, you don't understand. I'm taking my child with me everywhere I go because that time is so limited with them. And he said something that stuck in my head. This was way back at Emory, way back in the 80s. He said he attended a graduation for the chairman of the surgery department, a very famous hospital in South Africa. And it was at a retirement party that the guy realized he actually had grandchildren. He had no clue.
oh my goodness.
He didn't know his children's childhood was a blur. Their marriages were a blur. The fact that he had grandchildren was a blur. And here he is retiring and all the lights are turning out. And it's like, oh my gosh, I missed out on this life.
Yes.
And then another one was when I was at NIH, I did a lot of research. I was blessed to be with a very prolific scientist who wrote papers a lot. And we were sponsored to go on meetings. It was so fascinating. And I ran into this Greek fellow from Greece who brought her daughter. Her daughter was coloring under the table when we were in a big conference hall. I'm like, this is neat. And I said, what's going on? She goes, oh no, I take my daughter everywhere because I want to maximize. So those things start to settle in my mind. And I knew I wanted children. I knew I wanted children one day. And then going through fellowship, when you start taking care of patients with, premature ovarian failure, obstructive fallopian tube, failed IUI after failed IUI, IVF, and you start to think, oh my gosh, you start to see all these problems that this could be me, I need to start thinking about this. And if you're not in a field of fertility, maybe you're not close enough, you're not processing it, it's not registering that you could have infertility issue, right? A lot of physicians don't.
Yeah, that is very true. But a lot of physicians go through this issue and they talk
Yes.
about it behind closed doors, some never. And they carry that weight. I've seen, female gynecologists, obstetricians struggle with this. And they're
Yes.
delivering everyone else's babies and counseling
Yes.
everyone else. And it's like gut wrenching for them.
Yes.
Or-
They're the last to think about it. They do think about it usually when it's too late.
Yeah.
Some of them. I mean, we all went to medical school. We know the physiology of reproduction. We know about the ovaries and ovulation. I don't know if people know that you're running out of eggs, or maybe unless you're in the fertility field, but some do, some don't, believe it or not, which, it's not surprising, but some really don't. So I should take that back. But you can get caught up. You fall in love with the human body.
Yeah.
It's a special calling, Tomi, right?
Yes.
It's a special calling.
Yes.
To fall in love with the human body and what makes it work. And you dedicate your life to it, right? You set your whole life to this field. So we need to start taking a step back a little, daydream a little bit. And what I tell some of my patients is, if you were to paint a picture for me of you in your 70s, in your 80s, who's in that picture with you?
Yes.
What do you see?
Yes.
People don't step back to look at that. And if you see in that mirror children somewhere in that picture frame, we need to start talking.
100%. Yes. So let's start talking. Let's look at these perceptions.
Yes.
So, how do societal perceptions and stigma surrounding infertility impact female physicians? Because you would think that they should know better, right?
Mhm.
And what do you think
Mhm.
can be done to change these perceptions? Because for some, it's an uphill battle.
It is an uphill battle. You also have to look, we're not isolated from where we came from our culture, from our background. And now, I see a lot of patients from all over the world. They're physicians too. And you know, from the background we come from,
Yes.
it's always back in the day, you said you have to, go get the golden fleece, meaning go overseas, study, go
Yes.
get your PhD, get your MD, become a nuclear physicist. I mean, I speak for Nigerians now, but when I speak to my Indian colleagues, they're like, "Oh yeah, hey, it's the same thing." So
Yeah.
the pressure is on to do well, to excel. And if I must say so myself, a lot of Nigerians, they get PhDs and MDs, probably the highest demography in America right now that are getting those things.
Definitely
So-
the most educated group in America.
Yeah. So the push is on
Oh yeah.
culturally.
Yes.
So most people they listen to that expectation, but sometimes that expectation much.
Yes.
And then you have to, at what personal cost?
Yes. Yes.
It's easy for me. The push was never my parents. They're like, you do whatever you want to do, right? The push, if any, was just me. And because I wanted to be a physician, nobody wanted it for me. I wanted. So I had to sit down. What do I need to do to get there? So the push was on me. But culturally, the expectation is that you pursue your academic goals, your careers, and you stick with it.
Yes, that was my experience. I was the polar opposite. Mine was like, go to school, study, get good grades, and no boys. And then suddenly you're supposed to be, what's wrong with you? Don't you have time to have kids? What's wrong with you?
Yeah.
What am I gonna like polar vortex? So that whole period, people are mingling and getting to know people and getting to know themselves. That wasn't even there for me, because it was go to school and you're back, lock away, go read.
That's right.
Read.
Yeah,
and proud. Well. And then suddenly everyone else is getting married, everyone else is having kids, and you're like the spinster.
Yeah, I mean, I've had pharmacists and PhD and MDs that the mothers reached out to me first, and I'm like, oh, okay. So I could see who's been pushing this person all along. All of a sudden, they get into their late 30s. Now, grandma to be starts to panic. Well, where are my kids? Where are my grandkids? Well, you're the one that said push. So I think that female doctors need to defocus a little bit. Certainly don't feel pressured or pushed by your family. I always say that's a negative. That's a negative. It has to be your dream. But within your dream a little bit for yourself. Yes. Right? Dream a little bit for yourself and leave societal pressures alone where they belong. Because, Tomi, I tell you, I've had neurosurgeons, I've had nuclear physicists, and I'm talking African female PhDs and MDs who reach out to me and they're 44, 45. And I'm thinking, oh my goodness, where have you been the past 10 years? And it was always the same story. I was getting one fellowship. I went to this prestigious institution. I finished at Yale. I finished at Harvard. I went to Sloan Kettering. I've got this D's and that D, and I've got that research. What about you? It's okay to dream a little for you. It's okay to have dreams of personal life and plan, and it can be done. But sometimes you need to be proactive, because if you want to work hard and push yourself hard, no one in the medical field is going to say stop. No. They're not.
They're going to have to demand more. Patients.
Yeah. Can you take more calls?
Yeah.
Can you do? I mean, I remember when I did my trauma rotation. Oh my gosh, it was so brutal. It was 36 hours on.
Oh yeah.
And maybe 12 off if you're lucky.
Yeah.
And I remember the head fellow at that time who was in charge of he had gotten so many accidents going home, so many traffic citations. His license was removed from him because he kept getting accidents going home, and he had to take the bus home. And it was so bad, the bus driver on his route knew him and would say, okay, go to the back, go fall asleep. When I get to your stop, I'll wake you up.
But the funny thing is, we're allowed to go operate with those conditions. We're allowed to go to the wards. We're allowed to make critical decisions. You're expected to.
Yeah.
Yeah.
And those long hours, those sleepless nights, they disrupt your hormones. You have menstrual irregularity, lack of sleep, stress, long hours, right? And believe it or not, when they did a survey of some orthopedic female doctors, right? They, by the way, have the highest infertility rate, right? Surgical field, because it was brutal. They're on their feet for so many hours, and they're on call so many times, and they're trying to make a name for themselves in a male-dominated field.
Definitely male-dominated.
So you look at specialty by specialty, surgical fields have the highest infertility rates before the other ones, and of all them, the ortho fellows have one of the highest ones. Yeah.
Wow. It's crazy, but it's a real issue. Now, compared to the baseline for general society and physicians, how do physicians rank when it comes to infertility? Is it like significant?
So if the infertility in the general society it used to be 1 in 8. Now we're 1 in 6 now.
1 in 6.
Physicians are like 1 in 4.
Yeah.
So 1 in 4 would have used either fertility medications, sought fertility workup, done an IUI or an IVF. I mean, even though like I'm one of those 1 in 4, because when I decided I wanted to have children, I'm like, whoa, it's not happening as fast as I thought.
Yeah.
You know, I had to see a colleague of mine. I had to get treatment. I had to go through some procedures, some surgeries. And, you know, it was, and I was aware of all of this. I would think I started earlier than some of my colleagues that I saw now, that I see now. So yeah, it's higher in female doctors than the general population.
It's really tragic. And you know, it's again that uphill battle of trying to get pregnant, trying to make time to get pregnant. That's one thing. Find the partner or the donor, whatever it is.
Yes.
And unsuccessfully, a year goes by, you know, let's say you're under 35, you're not pregnant. That's a concern. If you're over 35, 6 months, that's, you know, like that's a concern. And then you get pregnant. What about even like health during pregnancy? That's one issue.
You know, that's another thing.
I was
Let
sick.
me tell you,
the whole pregnancy, 9 months.
Yes. You need help. Don't be afraid to ask for help. Help does not have to come from the traditional routes.
Yes.
Right? We can partner with each other. We can help each other out. I was blessed because my mother lived with me for like 9 years, right? So that I'll be forever grateful for. But it's hard when you're pregnant and you have no support.
Yes.
And then when you have your child, the sleepless nights and still having to go take care of patients. Yes. So I decided I wanted to breastfeed. Now, because I was at Holy Cross Hospital, one of my near and dear hospitals, as an attending, there were rooms for breastfeeding. There were lactation rooms. So I was really grateful for that. So we would go in the lactation rooms and there were other doctors and we would talk about what we were doing to support each other. So it's tough.
Definitely. Yeah. I remember pumping at work, nursing my child at work. But yeah, you need a team, and team doesn't have to be blood. You just need the team. You need that support for sure.
Yes. On
this journey. So I'm curious, you mentioned you've had physicians approach you and they're like 45, like mid 40s. Like, what are the usual outcomes at this age, right? Is it usually successful? Are they able to conceive usually? Or is it?
Well, when you are trying to conceive at an older age, the success rate is lower, right? The success is lower. Your the eggs that you have are a little bit not as good quality. So age has a profound effect on your success. So if you want to get pregnant, you want to start looking at age, right? The quality of the egg starts to go down. The quantity of the egg starts to go down as well, right? So that can be an issue.
Definitely. And besides age being a factor, I really don't like the name advanced maternal age, but geriatric mother, whatever. What other factors are common in female physicians?
We have to be careful about things that are in our environment, what's in the ambient environment. So whatever can affect your general patients will affect you as well,
Yes.
right? So now I know most doctors don't smoke, but some do, and smoking puts a lot of oxidative stress on your DNA. So you have poor quality eggs and you have poor quality sperm. So things like smoking. Now, there are some things that some doctors are not aware of. Maybe we're more sensitized being in the fertility field, but things in your environment, such as the makeup that you use, if you have makeup such that contains aluminum or other phthalates in them, those can be they're estrogen disrupting, endocrine disrupting products that can affect your egg or your sperm. So people don't realize is one of the things I'm an advocate for is be careful about consuming hot beverages or hot food from inside plastic containers because you get microplastics, right? And there's been literature where they looked at the placenta of babies and look at the quantity of microplastic in the placenta. Microplastics has really gone up in amount in the placenta. So doing things to avoid plastics, trying to avoid eating or having food in plastic containers, those are some of the minor things we can do. What kind of makeup or cosmetics you're using that has phthalates in them that you can avoid, would be very helpful.
Most definitely. That's a good point. Like our world is becoming more and more plastic. It's in our water. It's tragic. It's terrible. And we've only just begun to see the impact. But we know global fertility rates have been plummeting in other countries, but it's not good. And something that we definitely address. And let's not forget like the mental impact of this work as physicians. Like that's often an untold story.
Yes.
Do you want to share your thoughts about that and fertility?
I think that you're right. There is a lot of stress, and there are some physicians that work in probably like in a venture capital led facility where the ethos is volume. Yes. That's added stress on physicians. It's like you have to see X number of patients, you have to up the volume, you have to, that's stressful. I'm fortunate that I have my own practice, so I can set my own criteria, I can set my own volume, but not everybody is fortunate to have that. So when you're under, you remember the hospital in Atlanta that went out of business, and prior to them going out of business, they kept pushing the doctors to see more and more and more without telling the doctors that you have a problem with your hospital, right? They just keep beating up the physician. That can be, it's just stressful for those patients.
Yeah, definitely. I think over time, it weighs on a person. Like maybe at the beginning, it was easier. Like even in my life, when I first started, I could see 50, 60, it was crazy patients a day, like madness. I worked long hours. I own my own practice. Not doing that again. But now it's like, it's just too much. It's draining.
Yes. Yeah.
And you have to have that line in the sand where it's like, you got to have balance and have a life outside of medicine. What do you want? Like you said, when you're 70, 80, well, you got to do those things now to create that. Because some people think that, they'll just get to retirement and they'll have like their doting family or all these people around them celebrating them.
If you don't nurture them, they won't be there.
Exactly.
Yeah. And also not taking and I'm not perfect. I'm probably guilty of this, but also taking the time to go do our own doctor's visit. Like how many doctors have had a comprehensive metabolic profile drawn?
Yeah.
Right? Because we just don't find that time to nurture each other. But all those things can affect fertility. I mean, look at it. Doctors are graduating they're graduating medical school at their peak fertility.
Yes.
and then taking the time to go into fellowships and residency, right? So by the time they sort out the fellowship, the residency, they're starting to get past peak fertility. Time's starting to fly by, and that's why I wrote that article saying the ideal medical school graduation gift may actually be an egg freezing voucher.
Yes, that's very true. That's so true. Yeah, you don't need that vacation. You need that, that $8,000 whatever treatment.
Yes.
But yeah, we only have we're born with the number of eggs we have.
That's right.
And over time, the quality deteriorates. And it's also, we've been talking a lot about women, but men too.
Ah, yes.
Like, that's because, women get a lot of the flack. Oh, she can't have a kid. She's this. But there's male factors as well.
Actually,
and their sperms get old too.
Absolutely. It does get old. The increased incidence of autism with paternal age, increased DNA fragmentation with paternal age. So now we're telling men, you might want to consider freezing your sperm.
Yeah.
Believe that? Can you imagine we would ever come to a place where we would say that one day? Men need to consider freeze the best sperm, and that's whatever you have right now is going to be better than whatever you're going to have. No matter where you are in that stage, it doesn't matter. Freeze some of them. And also some men may have illnesses, right? High blood pressure, diabetes as they get older. So you'll have someone who may have had a normal semen analysis, 20 years ago, and now, we're having issues with either ejaculation, issues with sperm, quantity and quality. So that changes with time as well.
100%. And for the men listening out there, your process of freezing your sperm is very easy. Okay?
Yes.
Compared to a woman collecting eggs, it's like, correct me if I'm wrong, it's like night and day difference.
Yes. So they definitely should consider that. It's a two-way street. It's not just females alone. It's also male factor as well. And that's very crucial.
And there's also that catch-all, the unknown. Like when we can't find the reason why someone who has great sperm on paper and great eggs, but we're not making a baby, we're not conceiving, like that must be extremely frustrating. Well, that is frustrating.
There's so many factors that can affect, that's called unexplained infertility, by the way. And guess what? And this is maybe an aside. I don't think it's more common in doctors per se. I think it's less common. But another thing that I'm seeing recently, I think there's going to be an explosion of infertility in the next few years like we've never seen before, because now we have legalized marijuana. And people have no clue that the marijuana affects your egg and your sperm. Now, I don't care what else it's doing for you. And the reason I said this, I saw a young I think she was 29 years old. She came to freeze her eggs because she had a history of endometriosis, right? Which is another thing. If you have endometriosis, please freeze your eggs earlier than most people. But we did the first cycle and the egg quality was so bad. And I'm thinking, okay, yes, endometriosis can affect egg quality, but this was on a different level. And I said, what else are you doing? What are you? Because she never told me that. Oh yeah, I'm using marijuana gummies because I heard that it might help. And this is someone who has a master's degree. She's highly educated, biology major and everything. Her eggs were not good at all. And I said, we need to consider that you might need to give that up and consider a washout and consider repeating the egg freezing, because you may find that when you go thaw these eggs 10, 15, 20 years from now, that you don't really have anything good in the bank. And the same goes for men as well. I've had men where semen analysis is great, right? And give us sperm and it's awful. Or you have poor fertilization, embryos don't get to blast. What else are you doing? Oh yeah, I take marijuana gummies, I do this, that, the other. I'm like, yeah. I can't say it enough. I think like once every so many months, I put another social media post out there that it's not good for fertility. I'm not here to defend or go against marijuana. I don't care why you use it. right? You can say it's helping your cancer, your Alzheimer. I don't care what you say.
Yes.
The fact of the matter is, there is data out there that says it's not good for the egg and the sperm. So I think not, 22% of some adults use
Yes.
marijuana in one form or the other. So I think that we should really get ready for it. If we think it's bad, it's going to explode.
That is very true. Microplastics, toxic food, GMO this, and all the
Yes.
other global events. It's a lot, but
Yeah.
we need babies. We need a good fertility rate for humankind to continue and society function. Like we
We have declining birth rates all over the world, particularly in Europe, America, some parts of the world where there's strife and war.
Japan is struggling.
Yeah. So you can't replace your population. You got a problem. So infertility is rife, and it's even worse among doctors, right? So I would say, doctor, heal thyself.
Same. I say the same thing too. Physician, thy healer. Yeah.
Mm-hmm.
But we need to create a system that is designed for us. Healthcare system was not designed for women currently.
Yeah. As more awareness goes through, again, I think that because of my field, I did my residency in OBGYN. So I've always been fortunate to be in institutions that have been extremely supportive of all the female doctors, at least in my program, that came through, right? I can't say the same for other programs, but I just feel eternally blessed that I went to a program that was very supportive. And then when I started my practice, I was an attending in a hospital that was, it still is, at the forefront of maternal fetal well-being in the US and certainly in the state of Maryland. But it's easy to do when the institution supports you and gives you the resources.
100%.
So we need to call out to our institutions to be well aware. We need to have curriculum in medical school to tell our graduating medical students, because they'll be coming out medical school in their late 20s or starting residency in their late 20s or early 30s, and increase their awareness and give them the bandwidth to do something about it.
Yes.
Give them the bandwidth. It doesn't take that much time to freeze your eggs, right? The stimulation's 10 to 12 days, and then you go for egg retrieval. So if you are near a facility that's extremely supportive, where when you're doing your workup, when you're, doing your monitoring, they're flexible with when you can come in so that you can maximize the time that you might be taking off to get this done. So look around for who's willing to offer I know in my practice, I've taken care of a lot of doctors, and not just doctors, of medical residents too. And I try to accommodate. I know, when someone's been in labor and delivery up all night, I'm not going to be fussing at them. Why are you not? Are you monitoring? Appointment at 7 a.m. in the morning. I get it. Yeah. And the ones that I take care of, I give them my cell phone and I tell them, I'll work with your schedule because I know what you're going. Right?
Yeah. No, that's really, really good. That's refreshing. You don't hear that with your schedule. What? So to those in establishment who are listening, who have the power to change policies, to do better, what would you like to tell them? Because you definitely had a great example where you were trained, and that's a blessing. So let's encourage everyone else. So what would you like to tell them?
Well, we are your colleagues. Yeah. We are your troops in the trenches. Mm-hmm. We are the army that you deploy to go out and take care of patients.
Yes.
So if you take care of us, you are taking care of you.
Nailed it.
The healthier your female doctors are, the more they can put in, the more you get out of it. So even look at it from a selfish point of view.
Exactly.
If you take care of the caregivers, they have that much more to give. There's, again, I default to the program I went through. I really do feel blessed. We helped each other out. I mean, granted, when I was in medical residency, I wasn't having my kids then. But we had such a camaraderie that those of us who were not in the space of having children or trying to get pregnant, we formed a separate group and we helped those who were. So they don't have to worry about, oh my gosh, who's going to pick up my call? Who's going to cover for me in clinic? We all pitched in, and our male colleagues, bless their hearts, they were extremely very supportive. We were lockstep with them. And the fact that administration also gave us the bandwidth, that was probably one of the best things.
That's
and when as a young attending, starting my practice, being attending, teaching residents, being on call, it was extremely how would I say, I felt so blessed that the hospital administration was so supportive and gave us our own space. So I would go in this room with other young attendings. We were all starting around the same time, breastfeeding, sharing stories. They gave us access to the best breastfeeding team at no cost, right? At no cost to us. They gave us access to that resource that we could call upon. And I just felt blessed, and when I started having kids, I was one of those where my kids were, in the ICU, right? So, and that's another mental stress, right?
My second one, same thing.
Yeah, I had a baby in the ICU, and when I was discharged, I couldn't really go. I would be there first thing in the morning. I would stay, and finally, one of the nurses looked at me and said, "Dr. Famuyiwa, go home and get some sleep. We got your baby. She's in good hands." And just someone telling me that, you don't know how much it validated what I was going through. I felt supported. I felt heard.
Yeah.
And I felt cared for.
Wow.
Right?
Wow.
And even when I went home, when my baby was discharged with me, they actually sent someone to my house like every day for the first, because I was afraid. I didn't know what I was doing. I'm like, how am I going to touch this kid? This kid just came out of an ICU, right? But they supported me through an institutional program that I didn't pay for, right? So those little things help, so that when I came back from the time I took off to care for my baby, I was there 100%, right? So care for us. And it pays back.
It pays back, because this is a touchy but important subject for me. Like, my experience was the exact opposite. I didn't have the support. I didn't have the community backing, and it drained me, because then when I was thrown back into work, I was exhausted. And it's like, we look at stats right now. I think they say after 6 years, most 40% of female physicians either quit or go part-time. Go figure. And they also say in studies, women physicians have the higher post-surgical success, less complications, better outcomes. So we're totally rocking it as physicians, but we need
not for ourselves.
But not for ourselves. So it's a support. So if we're on the same team, it's like, help us. Don't be like, well, that person chose to have a child. Why should we be doing that? Because I hear that attitude when people say
and
things
also
like that.
Another thing that I validate from my experiences. Now, not everybody can have my experience.
Yeah.
But you can choose different career paths, right?
Yeah.
One of the reasons I went to work for myself, and I wasn't as busy in the beginning or have a big staff or anything, was I wanted the luxury and the freedom to go pick my kids up at 3:00, right? And bring them back to the office and have them work on their homework while I'm finishing my charting notes, right? So, and not every institution is going to permit that.
Yeah.
But it was my practice. I could do whatever I wanted. And that was one of the things I wanted to do. I wanted the luxury of being able to close down my office and go on my daughter's field trip, right? I wanted to be there when they were doing their athletic activities or their acting. And my daughter played on the orchestra and played flute. And honestly, to my ears, her music was the best. I mean, right? Forget all this. I could play her music as long as she was on there. That was sweet music. But I wanted to experience that on my own terms. So there is nothing wrong with choosing your employment that works for you. Yeah, and don't feel ashamed. I just saw one of the residents that I trained, who I had to validate because she finished her fellowship and went to work, tried private practice, didn't work, went to work in a government agency. And when I talked to her, she goes, "My kids are in kindergarten. I want to be there when they get out of school." And I told her, and I said, "That's totally okay.
Yeah.
That's okay. You can always rev it up when they graduate, when, now I'm an empty nester and I still feel my full vitality. I feel excited. I can rev up the number of hours I'm working. There are different seasons in your life, and you can accommodate your family aspiration to each season. Do what works for you.
Do what works for you. That is so powerful. That is so true. You have the right to choose. Even when I think about when I did that private practice 10 years, I was able to bring my kids to work. Any room was my nursing room if I wanted it. No one could tell me I had to stay.
Because it was yours.
It was mine.
Office. Yeah.
And obviously there's a lot of responsibility, but what I was able to gain with my kids, bringing them to work, having staff help me if needed, that was priceless. Because if I had just been in someone else's clinic where I couldn't even bring a kid into the building, I wouldn't have the relationship I have with my girls now.
Right. And for some doctors, it may be that what works is maybe not a full-time position. I've seen where physicians have split one position.
Yes.
Right? You have half an FTE and both female doctors could support each other and split that position. And it worked for them in the season that they were in, right? Seasons change.
Yes.
Your needs and your goals and aspirations, give yourself permission to change.
100%.
And figure out what works for your family. If it's a half FTE, or if it's a full-time, but you want to go in industry, you want to, work as a consultant. There's so many things you can do, and you are in the driver's seat because you only get to do it once. That time passes, and I think it's truly a tragedy when I see some of my colleagues who are in their 40s and 50s and they say, "I just didn't think about it. It just wasn't on my horizon. And now I desperately want it, but I didn't take the necessary steps I should have." I see that all the time. I still see it.
That's tragic, but it's reality. Everyone, we need to make best use of the time, seize the day, make the best use of it.
Correct. Yeah.
It's priceless. Because when we're old and, we're, 6 feet under, it'll be our families that'll be around us.
I mean, it's just, not everybody wants to have a child, but at least it's by choice.
Yes.
So
exactly, by choice. Exactly.
So what is your goal? And make sure that you are intentional about the choices you make, and then seek support. I've been blessed to be part of different female physician groups, and we help each other out, right? There's nothing wrong with that. I have several groups of different physicians that I'm part of, and one of the things that I cherish the most, and I think I tell them, is just that sisterhood that I was able to cultivate. I wouldn't give it up for the world.
That is beautiful. You really have it going on. Like, I love it. Like, it's like the utopian ideal situation. And even that ideal, I'm sure it could even be better. But compared to most, you had it great. And I'm glad that you had that and able to be a blessing to individuals, couples who are trying to create their definition of their family, right?
Yes.
Kids isn't for everybody.
Exactly.
But it's when you want it and you can't have it.
That's where the problem is.
That's the painful piece. It's like you're going through the motions that everyone does to get pregnant and it's not working.
Yeah.
That is frustrating. It can be a blow to your self-esteem, a blow to yourself.
It's hard. It's hard. And also you couple that with societal demands.
Yes. Cultural.
Couple that with cultural demands.
That one is
right. So people don't understand what you're going through. I remember when I was trying to have children, I've had these were doctors, right, who would come up to me and say, "Oh yeah, we know the problem. It's you, right? You're just so caught up in your career. You just don't." And that was so hurtful.
So hurtful.
Especially coming from someone in the medical field. And just because I'm not wearing my problems on my sleeve doesn't give you the right to, but they felt within our cultural context, they felt they had the right to come up to me and say whatever rubbish they wanted, disregarding my feelings.
Oh,
right.
Yeah.
And it hurt.
It does.
But I just had to put it in perspective. And I said, you know what? This is between me and my husband and no one else, right? But you are going through things and there are expectations, and cultural expectations can compound those issues and make it hard.
Definitely.
And then we haven't even got to the point that physicians also have one of the highest miscarriage rates.
Yes.
Right? Female physicians have some of the highest miscarriage rates because of stressors, whatever reasons, delayed pregnancy. And you don't always get support when you're going through a miscarriage as a physician. Who do you tell? They don't want to hear it.
They don't care. Most don't care. They don't. It's sad, but it's a reality that many women go through. It's heartbreaking. I know I went through one, and I miscarried at work, and everyone's telling me their problems. Patients are just like,
same with.
I waited 5 minutes for my appointment. And I'm just like so many things happen at work. You know, it's like you find out your family member dies at work. You this at work, like it's because you spend so much time at work. But then it's just like wow.
And another thing that's also adding to the stress, we're also in that age. Well, I'm past that age group right now, but women physicians are also in that genre of women that are in the sandwich generation, right? So you also have your parents that may be getting elderly and everyone else in your family saying, well, you're the doctor, you know, what do you think about it? Everything comes on you.
Yeah.
Right? And your patients and your family and your parents, that because you are the physician, they put a lot of this expectation on us.
A lot of a lot of expectation. The cultural as well, just messes everything up.
Yeah.
Yeah, it's complicated, but it's a topic that is important because 1 in 4 women will experience this.
Yes.
Right?
Absolutely.
And it's growing, and there's so many factors, and men too. You have your factors too.
Yes.
So let's really, my goal is to challenge people to think and change the way they do things.
Yes.
Let's change the systems in which we're in, because some of it is very punitive. It's like sometimes women are penalized for having children. It's very sad, but this is the world we're in. Like you said, physician, thou art the healer. Like, we need to work on ourselves, our community first, if we expect the rest to do it. But it starts with us. And like you also said, if you give the woman the support she needs in those critical years, when she comes back, she will be at her best versus ragged and drawn, stretched.
Yes.
Right? So let's do it. It's for the best interest of society.
Absolutely.
It's the best interest for shareholders' pocketbooks, those who care more that way. If 40% of us at 6 years in are saying toodaloo, bye, peace out, and most medical school graduates are women, hello, and boomer generation, I think a huge percentage, I can't remember the number, is at the verge of retirement.
Yes.
And it will take at least 4 new doctors to replace that one old school doctor. So there's a problem. It's like a cliff where at the edge.
Yeah.
And healthcare is the foundation of a healthy society. A society that doesn't have strong healthcare, wellness care is sick.
Yeah. So and that's why, I applaud the doctors that are out there who are coaching and championing women and saying, hey, hang in there, help is on the way here. Let's show you how you do things better. Let's show you how you can learn and be a mentor or a mentee to someone and find support groups. We need our support groups as well. And hopefully administration is listening and hearing us and supporting. And I think that more and more this conversation is trickling down all the way to medical school, saying that, these are the best of us. They're young, they're brilliant. And how do we care for them so that they stay longer in the fertility field? So that they, because when someone's stressed out and they go back and they think, oh my gosh, I gave my life to this thing and now I can't have any life of my own. I can't have my family.
The worst.
It's contributing to the stressors leading to people exiting the field. You talk about suicide rate, mental health. All those things are important.
Yeah, definitely. For me, at one point I took a break from the field, and the biggest contributing factor was children, my responsibilities, everything associated with it.
Yeah.
Lack of care.
And you don't get a do-over.
You don't get a do-over.
You don't get a do-over.
Yeah, and you give so much to a system that may or may not have your back. And that's the worst, when you give your best years, your prime, reproductive prime.
Exactly. Exactly.
And we need to change that. We do.
Yes. I think we need to have more of this there more.
Exactly. Yeah. And for those who are like, I don't want kids. Why is this my problem? That's their problem. They chose to. Well, remember, somebody chose to have you. Okay? Remember that.
So as long as
somebody's got to do it. If men could carry babies, we'd be like, yeah, sure, guys, you go ahead. You go get knocked up and carry that child. But it's us women with uterus are the ones who carry the children, and majority of the work associated with, well, obviously pregnancy and the early stage, especially if you're nursing.
Exactly.
So,
anyway. and I think it's callous for people to use the term geriatric pregnancy or what else? Why can't they just settle and be content? Why do they still want?
Yes, they say it's selfish. I hate that with you. Oh, they're old. It's selfish. I'm like, really? Some of the best parents have been quote unquote older parents.
So, I think that having this conversation and letting female doctors know that there are support groups out there and normalizing the conversation. I guess that's the word. Normalizing the conversation so that, everybody will say, oh, yeah, that makes sense. It's okay to think about your reproductive. That makes sense. It's okay to want to freeze your eggs, in your early 30s. That makes sense, right? So normalizing, because, believe it or not, it's not just patients that have stigma, but we also get stigma, right? So, except sometimes we can't verbalize it and we feel isolated or can't talk about it.
That is very isolating. The whole thing with privacy, it's like your colleague, that privacy piece as a physician working in healthcare.
Yeah.
But hey, you can travel for your fertility. So maybe share with the listeners where you're located, how they can reach you. Yeah.
So I am located in Rockville, Maryland, Montgomery Fertility Center. And you can reach us on montgomeryfertilitycenter.com. You can send us an email at montgomeryfertility@gmail.com or faqmfc@gmail.com. We're on, you can look up our social media angle on Instagram, Montgomery Fertility, on YouTube, Montgomery Fertility, on Facebook, Montgomery Fertility, and we're about to launch our own podcast called Fertile Talks that will carry more of this message. So I'm excited, can't wait to start that.
I look forward to hearing your podcast because I enjoy listening to you on LinkedIn.
Yes.
IG. So thank you so much for being here, sharing this hour with a very important topic because the world does not go on without having babies.
That's right.
And
exactly.
Physicians and healthcare providers are dear to heart.
Yes,
especially.
Absolutely. Yes. Thank you so much. It's been such a pleasure.
Yeah, and to our listeners, thanks for listening, whether you're a physician or not, but this is a topic that impacts us all.
Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.